And now on the line is Paula Leonard. Paula is the CEO of the Alcohol Forum, who are based in Donegal but are a national organisation. Paula, welcome back to the RFM.
Good morning, Darren.
Okay, Paula, I last spoke to you on Near FM, to you personally, at the end of March, although I spoke to one of your colleagues on this programme at the end of August. I understand that on Thursday of last week, the 28th of September, yourselves in the Alcohol Forum launched a landmark study on FASD, or Fetal Alcohol Spectrum Disorder, in Trinity College. I've done a couple of interviews on Near FM in the last couple of years about FASD, Paula, so it may so it may not be necessary to explain to our listeners on Near FM what FASD stands for and means, but in Ireland, Paula, FASD is not an insignificant problem, isn't it not?
No, fetal alcohol spectrum disorder is, at a global level, is the leading known cause of preventable intellectual disability in the population. So at a global level, it's a very significant issue. But in Ireland, unfortunately, it is estimated that we would have the third highest rate of fetal alcohol spectrum disorder in the world. Dr. Katie Tobin's study that we launched last week from the Global Brain Health Institute in Trinity includes that estimate that, we could have up to 5% of our children and young people in this country are at some stage on that spectrum of fetal alcohol spectrum disorders. So it's not an insignificant issue. You're absolutely right. There are higher rates than, say, Down syndrome, than autism spectrum disorder, than a whole range of other things and issues impacting on child well-being that we have addressed in this country. And that we have invested resources in, and that we've looked at the family support needs. And really, I suppose, when the report was launched last week, our call to action is that we want to see an improvement in diagnostic services. At the moment, there are none. We want to see, supports put in place for families that are struggling, and that have a range of challenges raising children with fetal alcohol spectrum disorder. And we want to see earlier intervention and supports for the children themselves. So, I mean, there's, in those range of recommendations, really, there's parts of those that need to be listened to by the Department of Children, and parts of those then that fall under the remit of the Department of Health. So, it's a really important study for us because it very clearly outlines sort of, the estimate prevalence, but really what the report did was it focused on the lived experiences of families across this country. And there are thousands of families across this country estimated to be impacted by this issue.
I was just going to ask you a question. I was going to ask you what was different about your study launch compared to other studies. So I think you just answered there. It's about families, your study, isn't it?
Absolutely. This is, what's called the caregivers study. So, in Ireland, we have a range of people raising children that are impacted by fetal alcohol spectrum disorder. So you have birth parents, you have foster care parents, you have adoptive parents. And unfortunately, there are struggles raising those children in terms of parenting without supports in place, without early interventions in place, without having a diagnosis. I mean, this study involved a survey of 70 parents. So, it's quite a big number for a study of this kind, and the first study of this kind. And it in detail sort of documented their experiences of looking for support, of struggling over many, many years, looking for a diagnosis, of not understanding sort of what was going on with their child, and, of meeting a lot of closed doors and unfortunately some closed minds, because, we did have a study a number of years ago of paediatricians in this country where there was a very low level of awareness that fetal alcohol spectrum disorder even existed. So that's the playing field we're in. There's an awful lot of work to do, but at least now we have something that makes visible the lives and the stories and the experiences of families, and I think that's an important starting point. So, big thanks to the Global Brain Health Institute in Trinity that worked with us and did the study, and big thanks to the Irish Research Council that funded the study, the first of its kind in Ireland.
Okay, I just have a couple more questions on this, Paula. I'm not sure if you answered this question, but or maybe you did. I'm not sure, but can you give a summary of what your main findings were in the study, Paula?
I suppose those are the key pieces, that we asked in relation to, did a child have a diagnosis? Because in this country we don't have diagnostic capacities. So we know that there are numbers of families who have a diagnosis from periods living in the UK, in Northern Ireland, or in America when they lived in other countries. We know that people have partial diagnosis, but what the big thing was that we found that parents of these children are having to negotiate very complex issues with schools who don't understand the issue, with health service providers who maybe don't necessarily understand the issue, with, social work services, with guards, actually. I mean, there's a very unfortunate statistic that, people with FASD in adulthood are far more likely to end up in prison. They're at an increased risk of homelessness, an increased risk of suicide, an increased risk of receiving a formal mental health diagnosis. So, we can't ignore the struggle that families have. And we can't ignore the struggles that people themselves with fetal alcohol spectrum disorder have. And we need to see them, and we need to hear them, and we need to support them. And I think those are sort of the key thing for me with the study was that it tells the stories and it makes visible the lives of families that really we haven't been addressing. And I mean, the HSE does have a prevention plan for fetal alcohol spectrum disorder, that very much focuses on raising awareness around the risks associated with consuming alcohol during pregnancy. That's a very worthwhile campaign, and it's a very worthwhile prevention plan. But this study is very different because it's saying, yes, absolutely, we need prevention and awareness. And yes, we need, health warnings in relation to alcohol consumption during pregnancy on alcoholic products. But side by side with that, we can no longer ignore the lived experiences of families and of people with fetal alcohol spectrum disorder in this country.
Okay. You just mentioned alcohol labelling there. That's a big thing that's coming in the next couple of years, isn't it?
Absolutely. And I mean, we did congratulate the Irish government on that at last Thursday's event in Trinity, because when alcoholic labelling, health warning labels come in alcoholic products in 2026 in this country, that will make Ireland, leaders in the European context. We will be the first country to have done so. So there's a lot of governments across Europe and public health experts across Europe at the moment looking at Ireland and seeing, how we will achieve that. So when that was announced by government, even though it's existed in the provisions of the Public Health Act 2018, but when government here in Ireland announced that they were going to go ahead and implement that measure in 2026, 7 countries in the EU lodged objections, and among those, the largest producers of alcohol. So it's a really important thing. And I mean, for me, it's a very simple one. I have a right to know the risks associated with any product that I consume or drink. And as a consumer, I have a right to know. If I have a right to know in relation to, food products, I should equally have a right to know in relation to alcohol products. And really, to me, that one is kind of a no-brainer. It's a very simple thing that consumers should have a right to. And at the moment, we are without those warning labels, but they're coming. So that's a positive step forward.
Okay, you mentioned there that I know that's part, the alcohol labelling is part of the Public Health Alcohol Act. Paula, is there any space for the Public Health Alcohol Act to cover what you were calling for in relation to FAST?
There isn't actually, because the Public Health Alcohol Act is a very large and a very progressive piece of legislation, but it's talking about the sale of alcohol, the marketing of alcohol, the visibility of alcohol in our communities, and all of that will bring consumption levels down. It will also mean that young people are protected from alcohol harm and may start to drink later. We may see decreasing numbers of young people consuming alcohol in this country. But what it won't do is it won't address the issues that there are for families right now. So we have thousands of young people in this country that are on the fetal alcohol spectrum. We have thousands of adults who are struggling with their mental health, their well-being, their home situations as a result of being on the spectrum, and the Public Health Alcohol Act won't address those issues. So really it's a matter now for, the Department of Children, the health service providers in this country and the Department of Health to come together and say, what are we going to do to provide early interventions, diagnostic services and supports for families.